This video is going to talk about modifiers 78 and 79. 78 says, unplanned return to the operating room by the same physician or another qualified healthcare professional following an initial procedure for a related procedure during the postoperative period. Most procedures, the postoperative period is 90 days. Okay. So if during those 90 days the patient has to be returned to the operating room and it was not planned that they were going to have to go back, and it was a related procedure to what they had done. Okay, give you an example. Say the patient had a hysterectomy, okay, and 3 days later calls the doctor, something's wrong. We do an evaluation and we find that the patient ripped their stitches inside and they're bleeding internally. We're going to rush them back to the operating room to fix it. It is related to the original procedure. Okay, it's part of the stitches from getting your hysterectomy. But this was an unplanned return. It's a complication that, shouldn't have happened, but it did for some reason. So we're going to need modifier 78, that we tell the insurance company that we are, during our postoperative period from this hysterectomy, we needed to do another procedure that was related to it, and it was unexpected. That's this procedure. Modifier 79 says unrelated procedure in the post-op period. So this means the patient needs two procedures that have nothing to do with each other, and they just happen to be on top of each other. Gives the example here, the patient gets their appendix out, and 2 weeks later they need their gallbladder out. It's just coincidence that they happen 2 weeks apart, because the gallbladder and the appendix, one didn't cause the other. It was bad luck. So we're going to tell the insurance company that this is completely unrelated to the postoperative period from the first surgery. Pay us. It's a whole different world, whole different reason we had to go to the emergency room or go to the operating room.